What's going on, everybody? This is Demetrius Harris, your DAC funding broker, and on this channel, I help business owners get access to funding in all types of industries. If you own a doctor's office, private medical practice, clinic, specialist practice, or healthcare business and need money for payroll, equipment, operations, or growth, this video is for you. Before we get started, make sure you like, subscribe, and hit the notification bell for more funding content. Let's get into it. A lot of doctor practice owners and healthcare operators are serving patients, building strong businesses, and bringing in revenue, but they still run into cash flow pressure when it is time to cover payroll, buy equipment, upgrade technology, expand services, or improve operations. In this video, I'm going to break down how doctor practice funding works, how businesses may access $50,000 to $2 million, what lenders usually look for, and how the right capital may help your medical practice cover payroll, growth, and equipment. Let's start with the reality of running a medical practice. This business has major expenses. You have payroll, rent or mortgage, utilities, insurance, billing systems, software, compliance costs, supplies, equipment, maintenance, and day-to-day operating costs. On top of that, many practices need capital for exam room upgrades, diagnostic tools, treatment equipment, computers, furniture, build-outs, marketing, and expansion. Even when a practice is generating revenue, these expenses can still create pressure on cash flow. That is why funding can be such an important business tool. One of the biggest challenges in a doctor practice is that payroll and operations do not stop. Doctors, nurses, medical assistants, front desk staff, billing staff, office managers, and other employees still have to be paid. Supplies still have to be ordered, technology still has to be maintained, the office still has to run efficiently every day. So even when patient volume is strong, there can still be timing gaps and operational pressure. That is why access to capital can make a major difference. There are many reasons medical practices seek funding. Some need money for payroll. Some need working capital for daily operations. Others need funds for equipment, office improvement, exam room upgrade, software systems, diagnostic tools, new staff, marketing, second locations, or growth into new services. Maybe you want to renovate the office, expand your treatment capacity, add providers, or bring in better equipment to improve patient care. The right funding can help with both stability and growth. Now, let's talk about what access to $50,000 to $2 million can mean for a doctor practice. At the lower end, that may help cover payroll, operational needs, and working capital. At the higher end, it may help with large equipment purchases, practice expansion, build-outs, renovation, additional locations, or major growth moves. The amount a practice may qualify for often depends on revenue, time in business, cash flow, and overall business strength. The key point is that funding can give medical practice owners room to operate and room to grow. One of the most important funding tools for a doctor practice is working capital. Working capital is flexible funding that can be used for day-to-day business expenses. That can include payroll, rent, utilities, software, billing support, insurance, repairs, supplies, marketing, and general operations. This can be especially important in healthcare because reimbursement timing, insurance claims, and overhead can create cash flow pressure even when the practice is producing revenue. Working capital helps keep the business stable and moving smoothly. Some doctor practices also need funding specifically for equipment. That may include diagnostic tools, imaging equipment, exam room equipment, treatment chairs, computers, software, monitoring tools, or other practice-related assets. Equipment funding can help you get the tools your practice needs without paying the full cost all at once. That can protect cash flow while still allowing you to improve care, efficiency, and growth capacity. Growth takes capital. Maybe you want to add another provider, expand office space, open another location, offer additional services, hire more staff, improve marketing, or increase patient capacity. Expansion usually requires spending money before the full return shows up. That is why funding can be such a major advantage. It can help you move on growth opportunities instead of delaying them because of limited cash flow. Now, let's talk about what lenders usually look for when reviewing a doctor practice for funding. First, they often look at time in business. Second, they look at monthly revenue and whether deposits are consistent. Third, they may review cash flow, bank activity, existing debt, and the personal credit profile of the owner. The key thing to understand is that lenders usually look at the full business picture, not just one factor by itself. A lot of practice owners think if their credit is not perfect, they do not have a chance. That is not always true. Credit matters, but so do revenue, time in business, deposits, cash flow, and overall business strength. So if your practice is generating steady revenue and showing real business activity, you may still have options available. That is why it is important not to count yourself out too early. One of the biggest mistakes practice owners make is waiting too long. They wait until payroll gets tight, equipment upgrades become urgent, or the growth opportunity is already slipping away. Another mistake is not knowing their numbers. You should know your monthly revenue, your major expenses, your debt obligation, and exactly what the funding will be used for. Other mistakes include poor record keeping, too many overdrafts, mixing business and personal finances, and applying for the wrong type of funding. If you want to improve your approval odds, keep your business deposits consistent. Separate business and personal finances. Reduce overdrafts and negative bank activity. Keep your records organized. Know your average monthly revenue. Have a clear use for the funds. And do not wait until your practice is already under major pressure before looking at options. Medical practice owners who prepare early usually put themselves in a stronger position. Let's say your practice is growing, but you need more staff, better equipment, and stronger worker capital to keep up with patient demand. Funding may help you hire, upgrade, and support the practice without draining your operating cash. Or maybe your office needs new diagnostic equipment, updated technology, or a bigger space to improve efficiency and patient experience. The right funding may help you make those improvements while keeping the business stable. The right funding can help a doctor practice grow in a major way. It can help you support payroll, improve equipment, strengthen operations, add providers, improve patient flow, upgrade technology, expand services, open another location, and create a better experience for patients and staff. When used strategically, funding can help move your practice from simply maintaining operations to growing with more strength and confidence. At the end of the day, doctor practice funding can be a powerful tool when used the right way. Whether you need $50,000, $250,000, or up to $2 million for payroll, equipment, operations, or growth. The key is understanding your options and positioning your business the right way. Funding should not only be viewed as a last resort, it can also be a smart strategy to strengthen your medical practice and support long-term growth. If you own a doctor practice, clinic, or healthcare business and need funding for payroll, equipment, growth, or operations, check the link in the description to see what options may be available for your business. And make sure you like, subscribe, and hit the notification bell for more funding content. And I will see you in the next video.